Hello guys, welcome to my YouTube channel. This is going to be my first YouTube video, and before we get started let me introduce myself. My name is Ghouse Mohammed and I am a final year medical student. Our first video is going to be about a little overview of dementias followed by two MCQs, and these questions are purely based on differential diagnosis and not on pathophysiology. We're gonna make 3 to 4 more videos on differential diagnosis of dementias with answer explanations. See how we do on these two MCQs and hope you like the video. Dementia is a neurocognitive disorder, and neurocognitive disorders are defined in DSM-5. There are two of them, mild and major. Major neurocognitive disorder is considered as dementia. There are There are 6 neurocognitive domains in DSM-5. The first one is executive function. This involves planning and decision making. Second one perceptual motor function. This involves perceiving the visual world around you and coordinating your motor movements. The third one is language. This involves naming objects and finding the right word. Number 4, learning and memory. This refers to recall. Number 5, social cognition. This is recognition of emotions and insights into the behavior. And the final one, complex attention. This refers to being able to sustain your attention on a specific task. These 6 domains are required to carry out your basic living. And there are 4 A's of dementias. The first one, amnesia, which is loss of memory. Then comes aphasia. This is inability to communicate effectively. Patients forget words and they have trouble understanding the words. Patients with dementia, they may not understand anything, but they still nod their heads to pretend. When you ask them to repeat what you just said, they are not able to repeat because they don't comprehend. The third A, which is apraxia, this is inability to do pre-programmed motor tasks. Patients with this cannot do their job. Patients who can work, they start making mistakes at work. If dementia gets severe, then patients cannot do things like chewing, swallowing, walking. And the final A is agnosia. This is inability to correctly interpret the senses. In this, patients cannot recognize people. Patients cannot interpret full bladder and develop incontinence. Patients cannot feel pain, so they feel irritable, but they cannot tell they are in pain. When we assess patients for dementias, we look for ADLs. ADLs are activities of daily life. Basically, these are activities of daily life such as dressing, walking, feeding, bathing yourself, toileting. And then IADLs, these are instrumental activities of daily life. These are the tasks required to be independent, example grocery shopping. And third one is advanced activities of daily life. This involves participating in family, social or work related roles. I hope you guys got it right. Okay, so looking at the important points in this stem, firstly patient's age, which is 82 years, and look at the highlighted portion of the question. Patient has been more forgetful over the last few years, and then patient is behaving paranoid. Patient believes his family, his son are behind him for his money and they're gonna kick him out of the house for his property, and also he has very poor short-term recall, like he cannot state the current American president. This is a clear Alzheimer's disease. CT scan and MRI shows diffuse cortical atrophy. You can see on the left is a healthy brain and on the right is a severe Alzheimer with cortical atrophy and enlargement of the ventricles. It's classic for Alzheimer's. Option A, dementia with Lewy body, is wrong because in dementia with Lewy body, patient has both signs of Alzheimer's as well as Parkinson's disease, and the progression is more rapid than Alzheimer's, and hallucinations predominate in dementia with Lewy body. Second option, frontotemporal dementia, is wrong because it is generally associated with personality, behavior, and language. It occurs in ages between 40 to 65, and patients with this, they are very inappropriate socially, they lack empathy, they lack judgment, they lack inhibition, and they have compulsive behaviors like clapping, smacking lips. They have compulsions like putting whatever they get into their mouths and eating inedible things. Option 4, pseudo dementia, is wrong because in this question stem, patient does not has depression or signs of depression or any medications like SSRIs. Fifth option, multi-infarct dementia, a type of vascular dementia, would be highly unlikely because there is no medical history of stroke or history of uncontrolled hypertension. Here's our second question. Please pause the video and try to answer it. In this question stem, patient is a 62-year-old woman. She has confusion, memory loss. Patient hallucinates, and these symptoms have worsened over the past 1 to 2 years. Hallucination is a sign of Alzheimer's, like intermediate Alzheimer's, and other symptoms like walking slowly, which is bradykinesia, hand tremors, lower limb rigidity, the symptoms of Parkinson's, and the mixed symptoms of Alzheimer's and Parkinson's is characteristic of dementia with Lewy body. So the answer here is dementia with Lewy bodies.